Hi, I'm Louise Nicol, the Editor-in-Chief of Harper's Bazaar Arabia. Welcome to this week's episode of Currently Trending, the weekly podcast brought to you by Harper's Bazaar. This week we bring you all the action from Harper's Bazaar's Be Beautiful seminar by bringing together an elite selection of the world's most in-demand beauty experts. Bazaar aims to educate and inspire our audience on the best ways to be beautiful both inside and out. These are the people that royalty, CEOs, film stars and supermodels trust with their looks. And this is what they have to say. This week, Munich-based Dr. Ursula Jacobs shares how her work treating cancer and diabetes has informed her approach to anti-aging and what we can all do to fight environmental aggressors. Give us a brief overview of what you do and why people come to see you.
Originally, I worked quite a long time in cancer and chronic diseases what are dependent on cancer, like any kind of internal diseases. And I wanted to know why things happening. What is the trigger? What is causing chronic diseases? Why is cancer coming up? So already 25 years ago, we developed with universities chemosensitivity tests where you can see in the tissues what kind of therapy is working, and now you do it from the blood, because on the cellular level, looking into cells, there is a very big, thank God, advanced medical movement now where you can see exactly what's going on. So dealing with these patients, I thought it's more important to know why things happening and look before cancer is coming or other degenerative diseases. And look, when we look around, here in UAE or also in Germany, diabetes is coming up very badly. Cancer is coming up very badly. Digestive problems coming up. So for me, it's important to find triggers, why things happening, and dependent on these triggers, what functions in your body are suffering.
Yeah, so we're all obviously here thinking about aging and thinking about our skin wrinkling and losing laxity, but also there's more serious implications to aging.
You cannot separate the inside from the outside. So what we have inside is shown on our outside. When cells, and I talk now about every cell in our body, is in a kind of balance and in the cell there is a stability, then you see it outside as well. When you're getting older and get little wrinkles, you can do a lot on a natural way. What everybody here is doing, sure, we can add that and we should add that at a specific point. But more important is that from inside we're staying healthy in a way. And let's say up to 25, 27, we already start to age and cells are degenerating. And then dependent on the genes what we have surrounding as well, and our lifestyle, we're aging faster or not as fast. Yeah. And then through this process, risk factors, what we carry in us and come out, knock specific genetical protections out, and then diseases are developing. And this is what we try to find out and what we work on since years, and the development in this field is also huge.
Yeah. For everyone who can't come and see you in your clinic in Germany, you've been working on this anti-aging panel. Tell us about what you're measuring here and how this works.
Yeah, this is a development what we did with a university in Vienna, not only because of the biological age, mainly as well as finding risk factors out, what we carry in us, what makes through the change of the cells inside a switch on or off of genes, what we cannot change. But knowing what kind of factors we have, we know exactly through that how our cells are aging, and we know what we have to take care of with food or exercises or whatever, dependent on what individually for us is a problem. So principally what we are measuring is we are looking into the cells, we're looking at the end of the genes, what called telomere, what already Dr. Storm talked about, because they not only have a specific lifespan, they are aging in a specific way, they are influenced by factors from outside and inside. And through the measurement of the end of the genes, we can see how is the biological age, to the age we are, and how we can influence that in a good way. So we're not only looking at that, we're looking at factors, how we keep inflammation, how is inflammation in our body, and what kind of, let's say, environmental problems like toxins, how we can deal with that.
Sure.
This is covered in this test. And a second big point, what all of us are interested in, me as well, is how we can form our body in a good way, how we can lose weight in a good way, because I have so many patients, they are doing diets, they are really, really eating healthy, they exercise, and they cannot lose weight. This has, as a base, for sure, genetically problems, but also risk factors from outside, what switches on the genes in a way that we start to produce anomaly, inflammation, that we cannot detox over the liver or over other organs what are detoxing, like the intestines, what we heard about, or as well, like over the kidneys. We cannot do this in a good way. And this is what we're looking at. So there are 4 specific types, genetically, metabolic types. And when you know your metabolic type, you know exactly, let's say, what to eat if you have to concentrate more on carbs. Some need carbs to lose weight. Others, they need fat to lose weight. So these are the 4 metabolic types we're looking at and what are scientific proved. And dependent on these types, you can see what kind of exercises you do. I have very often patients, men, who work out like crazy, muscles, and they say, I feel during the workout, I'm feeling going down after it, and it's not normal for me. So this perhaps is a type what needs to do other exercises, like walking, swimming, whatever, what is dependent on your genetical type. And this is also what you can find out. This logically is not changing, but what is changing, or what we can change, is the switch on of the inflammatory genes, or the genes, what helps us to detox over the liver, or as well what you can change is the intracellular lifespan, over increasing the little proteins at the end called telomerase. This we can achieve.
And how can you change them?
This we can achieve when we know what metabolic type is it, over exercising, food, and regular day and night rhythm. And there is a very good group of scientists what are working all over the world on that and trying to achieve that. And since cancer, and I worked for quite a long time also alternative in cancer, we know that herbs are very powerful. We know that antioxidants, what are coming out of herbs, are as powerful as, let's say, a specific kind of diet or a specific kind of exercise. And not everybody can take the same. So detecting, and this is the research from the last 2 years, what the herbs are doing exactly. And in cancer, we learned a lot about that. You can use that for prevention. Because when you want to make something for prevention and you, let's say, I would not say play around, because you cannot play around with genes or mess around, you should exactly know what you're using. And you only can use herbal products what are not enhancing a growth what we don't want to have in our body. So the herbs what we are using are based on research from oncology. And we started with a kind of what is called time block, what I think it's a good name, with herbs, and then through the development and through the surrounding problem, handies, computers, all of these electrosmog, you know, we see more and more degenerations, memory problems. We see that upcoming, also in younger people, not only in older, is coming concentration problems, focusing. This is a huge, huge issue, what is coming up. So there is an advanced formula, what we made trials on dementia patients in a big center, the dementia center, and we could show that through changing the ingredients of time block, we could stop dementia. And in patients who have concentration or memory problems, it works fantastically in keeping you sharp.
Sure.
And through the day and night rhythm, you get a better sleep, you get you get more awake during the daytime, so you get more concentrated and more focused.
Okay, so if taking this aside, because obviously this is going to do your own specific genetics and DNA.
Exactly.
If we take that aside...
It's not a gene test. It's testing how your genes are reacting.
Your genes are reacting.
It's not a genetic testing.
So obviously that has a very specific diagnosis for each individual. So if we put that aside and just generally as a room, if we could make 5 lifestyle changes that would benefit everyone here, regardless of their genes or DNA, what would you recommend everyone to do?
I would recommend that you should keep a specific day and night rhythm. Some going to sleep up to 2 o'clock in the morning, going up at noon. This is also okay, as long as you keep your day and night rhythm.
So keep it the same consistently.
You should keep it the same. You should look what you are eating. In no biological foods in Germany and Austria, mainly Austria, we're going really now in the good direction to really breed, let's say, animals as well as herbs in a biological way, keep them in a biological way. This is very important.
So organic, eat organic
food, exactly. Then it's very important that you keep your, let's say, your body and mind in a good balance, in a good shape, as also Dr. Sturr mentioned. Try to be happy. And what I think, coming to that, look, everybody of us have time 5 to 10 minutes a day. So we should see what we like. Either reading a good book or looking at something beautiful, doing a walk with our children or dogs, whatever. What you think it's good for you, do it. Also when it's only 5 to 10 minutes a day, but do it. And you should do it every day. This helps a lot in getting at the end a good picture. This is something what we should as well do. And then we know that we can switch on our, let's say, body and mind through yoga or through relaxation. Mechanically, it works like this, that we, over a nervous system, what is called vegetative nervous system, where the root nerve is in our abdomen, through breathing, you stimulate this nervous system and you put out a very good amount of neurotransmitters, what makes you balanced, what makes you relaxed. And this is what we need nowadays. So you have to keep your nervous system in a specific balance. And this you can do by your own, in exercising a little bit, making yoga, taking 5 minutes in doing things what you like to do, independent from all others.
There's no excuses for not doing those.
No, there is no excuse. Everybody has time, 5 minutes to 10 minutes a day.
They do. So for those of us who live in the region, in the Middle East, where the climate is harsh, we've got air conditioning, we're working out in air-conditioned gyms.
This is a point what I also want to say, because mainly in this region we know that air conditioning, we have to live with air conditioning. There is no way living without. But we have to see our evolution. Look, in the European countries, through industrialization, we are used to pollution for a longer time. So our grandparents or the generation before already had this pollution, so specific processes in our body started, and we get it from generation to generation, so we can deal with it in another way. Look, this is a very young country, and 40 years, a little older, and it's only less than 1 generation. So from being without any air conditioning, jump 40 years later to all of these modern world, our body cannot cope with that in a good way. So you have to keep your immune system strong, and you have to keep your detox system strong, that you can deal with the, let's say, with the problems what we get through air conditioning. Because what happens? What happens in air conditioning? Hot air is coming, you transverse it to cold air, so we have specific pipelines, and when they are metal, they can erode, and you can breathe in. When the cold air is pressed out, toxins, for example, or as well pollution things from outside coming in and get, let's say, changed into cold air, and you breathe it in. Over the shower, you can breathe it in. So you have to keep your immune system in a good shape. And this you can do through exercises, through keeping a day and night rhythm in a good way. And we did studies about really collecting from all over Middle East, also here, the dirt of the air conditioning, and we found typically germs, what makes allergies in children, and what makes a kind of eczema in grown-ups and children, or all of these things, stuffed nose, running nose, has to do with that. So homeopathically you can do something, but the best is to keep your immune system running and to keep you in a good shape in making this what we talked about before.
Sure, with those tips, great.
Yes.
Well, that's really informative.
And this you can do easily.
Yeah, we can. We've got no excuse.
Yes,
and if we want to, we can do
excuse.
this as well. Thank you so much.
That was
welcome.
great. Thank you, Dr. Jacob.
Thank you for listening so late.
Thank you for listening to Currently Trending from Harper's Bazaar Arabia. Please comment on our Instagram or Facebook pages at Harper's Bazaar Arabia. And don't forget to rate, review and subscribe on iTunes.